can put a rinse where you can just squirt in your cat's mouth. There's also some things that you can put in the water as an additive to help keep their teeth clean.
You have to be a little careful about the water additives. They are good, but somebody has to smell that water additive when they drink water. And it's so critical when they drink water that if you start that, start it real slow, maybe even like a drop at a time, and increase it so that they get used to the flavor. And you're very vigilant to see that I put this much water in, and every day she usually drinks it down to this much. Now she's not. That's real critical. Okay? So if you try one of those, just be aware.
Okay, kidney disease. That was one of those 5 that we talked about at first. Again, weight loss. Increased drinking. Normally when you got increased drinking, it's got to come back up, so the increased urination, a decrease in appetite. So might not be eating. Again, some of these signs will be for multiple problems. When you go to the litter box, you might see that there seems to be more urine actually in the litter box. And it might be different colors too, or different smells. Again, vomiting. Arthritis as we age, you know, the back might be a little sore, the knees might creak a little bit, and same thing with cats. They having trouble jumping. They might not be popping up quite as much. We have a 12-year-old cat at the clinic. Still gets up high, but not quite as easy as when she was a kitten. Might be moving around and showing, you know, it's sort of like having difficulty getting in a comfortable position, you know, constantly, okay, moving like this. Could be a sign of arthritis. Hey, we got this picture here that's sort of that arching back, you know, trying to stretch out the back to get the muscles going, and the problem is because there might be some arthritis going in those joints. Shaking legs would be just skin and grooming issues. You know, some of these sort of interact with each other. If your cat has arthritis and has a little bit tougher time moving around, it's going to have a tougher time grooming. So take a look. Is that fur changing? You see a little bit underneath the fur on the actual skin. Does it look a little redder? Does the coat smell? The difference in smell. And like I said, having more hard to reach spots. Older cats, we see a lot of older cats that have matting issues, and that you need to be able to train your cat early on to be able to groom and just brush. And again, if you go around to these cats here today, and it's just amazing on what they can just brush that cat. The cat's like, oh, this is great. You missed the spot right here. But if you can do it as a younger cat and they continue on in senior cat, when they need help with that grooming, that's going to help them a lot. One of the other things about that is if they might have more problems at the rear end because they can't get back there to groom themselves. So, is there anything we can do? Well, your veterinarian is going to be able to do some things, and we're going to talk about that right now. It starts off with diagnostic testing. And we got six different ways other than, we'll talk about the exams here in a little bit. One of these is sort of unusual. The first thing we'd always would recommend is blood work, because that gives a doctor a window into the body that supplements the physical exam. But all these others are the same thing. They're looking at different portions of the body, and they can tell if something's going on. The one that's sort of unusual is the laser therapy. In dogs, sometimes a doctor will... How many of you have a dog? Where everybody, just cats, okay? In dogs, sometimes they'll give a medication for a senior dog called Rimadyl. That's a non-steroidal anti-inflammatory drug, an NSAID. We'll give a trial dose and say, just see how your dog does on it. And it's pretty safe. And they come back a week later, and a lot of times they say, golly, my dog's doing a lot better. Well, in the laser therapy, it's something similar to that. We can try it and just see if it works. By the way, in laser therapy, it's the same type of laser that's used for people for therapy. So I was down in Florida, my wife and I were down in Florida visiting her dad, and drove by a chiropractor that was saying, offering laser therapy for people. Is it successful for everybody? The answer is no, but for about 90% of the time, it's going to help with certain conditions. Laser, we're actually going to demonstrate it tomorrow. Yeah, we'll have something on the website. And actually, on the website, there's a link to a video that talks about it a little bit more.